My name's Gershon Kutsi and you are watching Melo TV. As a proudly South African company, we would like to congratulate the Springboks on the historic Rugby World Cup title and for beating the All Blacks. Now, October is Mental Health Awareness Month, and it's important to look after your mental well-being. We now chat to a specialist psychiatrist and an occupational therapist regarding their role and our facility that we have at Melomed Claremont.
So mental health issues are incredibly common. We think that 1 in 3 people have a serious mental health issue. We see a lot of stigma in and around mental health, and this is something that we as the Melomed group take particularly interest in that we're very sensitive to the local community, their needs and their perception around mental health.
The stigma around mental health and mental illness is real, and often it takes a lot of courage to come in. And I always say to patients, when we want to change people's perception about a space like this, it only takes one person at a time. And so to come in and to experience it and to go out there and to say to them that it's not what the movie says or it's not what people perceive it to be, that it's a space of healing and more importantly, it's a space of hope.
Our facility at Claremont Life Skills is a place of where it's a safe, serenity place of tranquility, where you will find that you can spend your time of the whole 21 days, where you can find time to heal and feel that you were able to be cared for. And when you leave, you will feel that you're on the right path of healing to your next journey.
So I think for us, a big role is empowering people to make the best of their lives, because mental health issues can stand in the way of people reaching their full potential. Of course, we see lots of emergencies as well. So there are people, suicidality, as we were discussing earlier, something we see almost on a daily basis. Life is incredibly stressful. Modern day life has really taken a turn in a very stressful way. With social media, we just bombarded with all kinds of inputs all the time. There's traffic, the traffic in Cape Town has become insane. All these daily little things, financial insecurity, lots of our people are unemployed, people are really struggling. The country has been going through lots of difficulty. The pandemic recently has really increased the need for mental health services significantly across the country and in fact across the world really.
The main aim of our occupational therapy program is to improve function. In patients' function in terms of their emotional, their physical, even their spiritual functioning, we want to improve. So we encourage patients to look after themselves from day one, to get back into a routine, to follow the program, because order and structure is really important when you're not in a good space, when you're feeling anxious, when you're feeling depressed. Often everything is overwhelming, and what the program offers, it offers that structure to reconnect with yourself and to find yourself.
So we work in a multidisciplinary team. I must say, everyone's really experienced, and having been a senior in other settings before, I can tell you that people are very experienced. We work very collegially along with each other. We have psychologists, we have OT, we have an excellent group of nurses as well. And by and large, I'm really, really impressed having started in this group over a year and a half ago with the quality and there's that extra kindness that all our patients speak about, that extra mile that people go, our staff go for our patients. That is, I think, a strength of this facility. So now more than ever, there's the slogan, there's no health without mental health. So the Melomed group, what's nice about that is we work very closely with our other specialists as well across the Melomed group. So we interact with the physicians and the gynecologists and all the specialists, and so that's a big strength we have here as well.
When you are admitted, it will be daunting, and you will feel that it will be a new environment. It may be very scary, but you will be received by an excellent nursing team that consists of trained psychiatric nurses. It will be nursing assistants. It will be carers that are trained to care for the specific needs. and they will look well after all your needs, your psychological needs, your physical needs, and your emotional needs. And they will be with you for 24 hours of the day. You will never be left alone. And they will be during the time that you're here, which is 21 days. They will take care of you.
So the medical aids allows the patient to access our facility for a maximum of 21 days, and we then run a 3-week program, so 3 5-day weeks and then the weekends. And they say it takes 21 days to change a habit. And I always say to patients, if you start on day 1 with, example, wanting to drink 8 glasses of water, there's a good chance that once you're discharged, you'll continue that habit. And that is often the smallest goal that we set for patients. Sometimes the goal is just saying no to somebody who wants to invade this space, or say no to somebody who crosses the emotional boundaries. So 21 days, there's evidence that if you want to change a habit, it takes 21 days.
So I want to tell whoever's watching this video out there, if you do need help, or you see a family member or a colleague or someone, the first thing to do is to start talking about that. Sometimes just talking to each other or involving a priest or an imam or a best friend might be the first step. But if there is a real mental health issue, then there are services available. Please reach out. This can be the difference in some cases, unfortunately, between life and death. And like I said, the suicide rate in South Africa is astronomical. Every couple of seconds, there's someone that commits suicide, unfortunately. These are things that we can mitigate. And then, of course, there are many other people that are struggling with a whole range of mental health issues, from depression to anxiety, to substance abuse, to bipolar, to schizophrenia, many different kinds of illnesses. But please do get help. Be kind to yourself, be kind to others, and get the help that is necessary.
Mental health is health. And that's important, is to look after your health, whether it's your physical health or your mental health. And so I encourage patients to take the step. I know it can be very scary coming into a space like this, but importantly is to try it. It grows on you, like I always tell my patients, and after 3 weeks they've had a very good experience. But it's to take the first step, to ask for help, which is often the most difficult step to take. But if you reach out, we will meet you halfway, and that's all we're asking.
My advice is, we know so much more about mental health and mental illness now. There are so many more treatments that are available. In this group, we just use international and locally scientifically based standards. And please come, and it can make a massive, massive change to your life. You do not have to live with this illness or these challenges any longer.
Thank you to our professionals for sharing their knowledge regarding mental well-being. And as you heard, it is best to brush aside the stigma attached to mental well-being and seek help. Also, to our matriculants, we'd like to wish you only the very best to your end-of-year exams, and to everyone else writing exams, we wish you only the best. From all of us at Melomed, thank you for watching this video. Until next time, goodbye.